Breaking news: huge changes are coming to your local GP surgery this October and you need to know about them. But before we dive into all the major updates that will completely change how you book appointments and access NHS services, make sure you subscribe to this channel right now for more important updates, health news, and everything you need to stay informed. Now, let's get into what could be one of the most significant shifts in how general practice works across England. Starting from October 1 St. 2025, every GP surgery in England will be required to follow a new set of national guidelines that aim to drastically transform how patients interact with their local practices. The main goal? To eliminate the dreaded 8am appointment rush that has caused frustration for millions of people over the years. You know the drill: the clock strikes 8am, the phone lines are jammed, everyone's trying to get through at the same time, and appointments are gone in minutes. That chaotic system is being replaced with something much more streamlined and patient-friendly. According to Dr. Tim Mercer, a general practitioner involved in communicating these new changes, the shift begins with the introduction of a new mandatory patient charter called You and Your General Practice. Every GP surgery across England must display this charter and follow the principles outlined within it. So, what exactly does this mean for you? First off, it guarantees that all GP surgeries must be accessible from 8am to 6:30 p.m, Monday to Friday, which is already a big step forward for accessibility. More importantly, it means you can now contact your GP practice in multiple ways, whether it's in person, over the phone, online via your surgery's website, or through the NHS app. No more fighting for a phone line first thing in the morning. But that's just the start. The entire process of booking an appointment is also being overhauled. Under the current system, you call your surgery, speak to a receptionist, and hopefully get an appointment at some point in the future, depending on availability. However, patients have long complained that this process feels inconsistent, impersonal, and often unclear. With the new model, when you contact your surgery, whether it's online, by phone, or in person, you'll be asked to provide some basic information about your issue. This helps the practice triage your request based on clinical urgency, not just first come first served. The key promise under the new rules is that you'll be informed within one working day what will happen next. That means no more being told to just call back tomorrow. Your request might result in a same-day appointment, an appointment on the following day, or advice via text message, directing you to a pharmacy, another NHS service, or self-care at home if appropriate. The point is, there will be clarity and communication, which have been missing from the current system. Now, let's talk about expectations and rights. One of the principles in the new patient charter is about mutual respect and understanding. While GPS will aim to accommodate your preferences, like seeing a specific doctor or healthcare professional, there may be longer wait times if that person isn't immediately available. That said, practices will do their best to meet your request, especially if continuity of care is important for managing a long-term condition. Additionally, you can nominate someone, such as a carer, to speak on your behalf, provided you've given consent. Now, onto some more technical but important updates that surgeries must implement as part of the October reforms. Every GP practice in England will be required to have an online consultation tool active and available throughout their core hours. That means from 8am to 6pm every weekday. These tools allow patients to submit non-urgent medical queries, administrative requests, and even questions about medication, all without needing to call or visit the surgery in person. However, safety is still a top priority. There will be built-in safeguards to make sure people don't accidentally submit urgent health concerns through online forms. Those issues still need immediate and appropriate attention. So, practices will actively monitor and triage incoming online requests, ensuring that each one is properly reviewed. Simply sending an automated message confirming receipt of your query is no longer enough. You must be told what's going to happen next. And don't worry, even if surgeries aren't required to keep their doors open for walk-in visits all day long, they must make themselves accessible in other ways. That could mean having a doorbell system, a buzzer, or even just making sure phone lines are monitored. Accessibility is no longer optional, it's essential. Another big change that's being enforced is the publication of the You and Your General Practice Charter. Every GP surgery must not only follow it but also publish a link to it clearly on their website by October 1. This document outlines the expectations from both sides, what the patient can expect from their surgery, and what responsibilities patients have in return, such as attending appointments, providing accurate information, and giving feedback where necessary. It's about creating a collaborative environment, not an adversarial one. Now let's move to something that could truly save lives: the introduction of Jess's Rule. Coming into force on September 23, 2025, this new patient safety initiative is being rolled out by NHS England in collaboration with the Royal College of GPS. It's called Jess's Rule in memory of patients who tragically experience delayed diagnoses. This rule introduces a new protocol if a patient has had 3 separate consultations for the same unresolved symptoms, or if their condition is clearly worsening, then the GP must take action. That action could include escalating the case for further investigation, requesting diagnostic tests, or referring the patient to a specialist. The idea is to stop potentially serious conditions from being missed or delayed, which has sadly been an issue in the past. This is especially crucial when it comes to conditions like cancer, autoimmune diseases, and rare illnesses that may not be diagnosed easily in the first or even second visit. Jess's Rule ensures that GPS are required to pause and reassess cases that aren't improving, rather than continuing with a wait-and-see approach. It could be a game-changer in reducing misdiagnosis and catching life-threatening illnesses earlier. In summary, the major changes arriving this October aim to modernize general practice, put an end to outdated appointment systems, and put patients at the heart of healthcare decisions. You'll have more ways to contact your GP, you'll receive timely updates about your request, and you'll benefit from clearer communication and quicker escalation when something's not right. It's a major effort to improve accessibility, transparency, and patient safety across the board. So, whether you're someone who regularly visits the GP, or you only go when something's really wrong, these changes are going to affect everyone in England. Gone are the days of ringing endlessly at 8 am, being told to try again tomorrow, or waiting weeks for clarity. The new system prioritizes clinical need over the order of requests and gives patients the dignity of knowing what's happening with their care promptly. Make sure you're aware of what your rights are under the new system. Ask your surgery if they've implemented the new tools. Check their website for the new you and your general practice charter. And remember, if you're not getting the care you're entitled to, you have the right to raise concerns, and now, the framework will support you better than before. This is more than a policy change. It's a cultural shift in healthcare delivery. And it starts with information, so share this video with friends and family who need to know about these updates. Stay informed, stay empowered, and make sure you're getting the care you deserve. And finally, if you found this breakdown helpful and want to stay up to date on the latest NHS changes, healthcare tips, and essential news that matters to you, then make sure you hit that subscribe button right now. Turn on notifications so you never miss an important update. Thank you for watching, stay safe, and we'll see you in the next video.